Okay, let's talk about feedback. For way too long, we've treated it like some kind of vague, soft skill. But today, we're going to treat feedback for what it really is, a core clinical procedure. Yep, you heard that right. It's an art, for sure, but it's also a science, a skill that we can diagnose, practice, and honestly, master to become better doctors and way more effective teachers.
You know the feeling, right? You're rushing between patients, and a senior colleague just grabs you in the hallway. Hey, good work on that admission, but you need to be more confident with your consults. And then poof, they're gone. And you're just left standing there thinking, okay, what am I supposed to do with that? Is that feedback a gift, or is it just another confusing burden in a day that's already packed with stress?
So let's approach this like any challenging case that comes through the door. Before we can even think about prescribing a treatment for our feedback culture, we have to get the diagnosis right. We need to really understand the symptoms of bad feedback before we can ever hope to find a cure.
So what are the symptoms? Well, on one side, you have the kind of feedback that just falls flat. It's super general, it feels kind of punitive, and it's ambiguous. You know, things like read more or just be more efficient. On the other side, that's our goal. Feedback that's specific, feels genuinely safe, and is something you can act on right away. One just creates confusion and defensiveness. The other, it creates a clear path forward. That's where we want to live.
Now, before we get into any fancy models or scripts, we have to lay down the one ground rule. This is the absolute, non-negotiable foundation that makes everything else we're about to talk about even possible.
And that foundation is psychological safety. It's just the core belief that you can get feedback, that you can ask a question, or even admit you made a mistake without any fear of being shamed or punished for it. And this is where leadership is so critical. As attendings, as senior residents, the responsibility is really on us to set this tone. Without it, the best feedback script in the world is totally useless.
With safety as our bedrock, a few key principles just naturally emerge. And honestly, the most critical one is that feedback has to be specific and observable. We're talking about what someone did, not some label of who they are. That simple shift, focusing on behavior, makes it actionable and forward-looking, and it turns what could feel like a critique into a real two-way conversation about getting better.
All right, let's get practical. For the person who's giving the feedback, we have an amazing tool called the coach model. I want you to think of this like a quick clinical procedure. It's structured, it's reliable, and it's a way to get a great result pretty much every time. And I know what you're thinking. I do not have time for this. And that's the most powerful part. This isn't some big, drawn-out meeting. This whole framework is designed to work in just 2 to 3 minutes, right there in the flow of a busy shift.
The model gives us a super clear path. So, C starts with context. Where and when did this happen? O is for observation, 1 or 2 specific, neutral things you saw. A is for an actionable suggestion, 1 concrete thing to try next time. C is for clarifying coach. You've got to ask for their perspective. And H is for homework and handover. You agree on a follow-up plan. It's just a clear, logical flow that takes all the guesswork out of it.
Let's make this real. Imagine saying this. During the stroke handover, I noticed you summarized the CT findings clearly. One small change. Ask the receiving team any questions about the plan. Let's try that on the next handover. See? It's direct, it's kind, it's specific, and it's totally forward-looking. That right there is the coach model in action.
But hey, feedback is a partnership, right? It's a two-way conversation. So now let's flip the script and empower the person on the receiving end with their own powerful tool, the listen model. This model is all about taking back control. It shifts you from being just a passive target of feedback to being the active driver of your own learning. L, listen, don't interrupt. I, interpret it back to them to make sure you understood. S, seek specifics if you need more clarity. T, thank them. E, execute by proposing your own action plan. And N, note it down and agree on a follow-up. This is all about taking ownership. And here's what that actually sounds like. Thanks. So you observe that I didn't do a teach-back. I'll try the one-sentence teach-back on my next 2 discharges and ask you to watch one. Does that timing work? Did you see what just happened there? The learner is now co-creating the plan. They are in the driver's seat of their own improvement. It's a total game changer. So we have the tools for both the giver and the receiver. Now, the big question, how do we make this a regular habit instead of some rare, awkward event? Well, the key is to embed these practices directly into our daily and weekly clinical rhythm.
We do this by creating a rhythm with different types of feedback. You have that in-the-moment micro-feedback using the coach model, those really quick 2-minute course corrections. Then you can have brief end-of-shift debriefs to reflect as a team. And finally, you have your more formal weekly or monthly sessions for the bigger picture goals and reviewing progress. It's about mixing those immediate adjustments with long-term growth. Okay, we've covered scripts, models, routines, but I want to end on the single most important factor that will determine whether any of this actually makes a difference in your program.
It's this, plain and simple. A perfect script is useless if the faculty and system tolerates public shaming, ignores follow-up, or lacks role models. No tool, no technique can fix a toxic culture. The ultimate goal isn't just to use a script, it's to build an environment where feedback is seen as routine, helpful, and fundamentally, an act of care.
Because at the end of the day, that's what this is really all about. This isn't some top-down critique from an expert to a novice. It's a partnership. It's a shared journey where we all commit to helping each other become the best, most compassionate, and most effective clinicians we can possibly be.
So I'll leave you with this one simple question. What is one small step that you can take this week? Maybe it's just trying the coach model one time. Or maybe it's using the listen framework the next time you get some feedback. Think about it, because that one small, intentional step is how we begin to change the entire culture.